Hi there and welcome to the Health Anchors Learning Network. This is one of our resources for people who are a little bit newer to the concept of anchors. So it's a short overview of what that term means and some of the different strategies which are available for anchor organizations. So what is an anchor organization? Typically, they are large, not-for-profit or public sector organizations that are based in an area. So their mission or purpose is really closely tied to a geography or a community. That might be often because they deliver services there or they have really significant estates or physical resources in that place. And typically they are amongst the biggest spenders and employers in that town, city or region too. So classic examples of anchor organizations might include hospitals, universities, housing associations, or large cultural institutions. The term community anchor is also quite common in England and often refers to community organisations that are very closely tied to a geography, but they perhaps don't have the same scale and economic power that some of the larger public sector institutions do have. And another term that you might hear coming up quite a lot is an anchor collaborative or an anchor network. These are groups of anchor organizations that are all based in a certain geography. So they might all be based in a certain region or a particular town. And increasingly, they are coming together in networks or coalitions and looking at what they can do together to improve the social and economic and environmental conditions of that place. So why does this matter? Why are we talking about anchor organizations and what is the potential of what they can do? The idea has really come to the forefront of thinking in a lot of different sectors in the UK, in both health and also in housing, arts and culture, higher education and universities, because it offers a way of thinking about how all of the resources that an organization has can be better directed to tackle the determinants of poor health, poverty, inequalities. So hospital systems, for example, might be delivering frontline services, but the anchor framework would invite you to think about how do your estates, your spending, your workforce, how do all of your operations and corporate functions contribute towards that mission or purpose of greater health and well-being and prosperity for the local population. So an anchor way of thinking would be thinking about how all of the resources that you have can improve social, economic and environmental determinants of health and reduce inequalities, not just the frontline services that you're running. And particularly at the moment where there is such a great focus on health inequalities between different groups, this offers a way of thinking about much more intentionally directing those resources towards particular outcomes. And those outcomes will vary depending on the area you're based in and the community that you work with and serve. Anchor organizations typically have 5 or 6 main strategies or levers that they can use to narrow those inequalities or take action on the determinants of health. And the levers that you have available will depend on the size and scale of your organization and other factors such as the scale of your estates and your existing relationships with the community. One of the biggest ones that is often used is procurement and spend. So many anchor institutions have budgets for external goods and services that run into the hundreds of millions. And thinking about how you can use every pound of that spending more intentionally to benefit particular groups would mean you are looking at using procurement as a key anchor strategy. So that might mean everything from catering and cleaning contracts through to where you buy your pens and pencils and the organizations that you purchase from, having working with them and their supply chains to have a much stronger impact on the wider determinants of health. So that's procurement and spending. Workforce, employment and skills is also another really, really key anchor strategy. And that can be everything from targeting recruitment more directly to groups who are more disadvantaged in the labour market, particular cohorts or populations in the community that you are based in who are less represented within your workforce or face additional barriers to work, but also progressing, training and moving people up through the organization who are on lower pay grades. So there are more explicit structures for progression that again address some of those characteristics of disadvantage and inequality that shape the local population and the workforce. So anchor organizations might, for example, partner with local colleges or higher education institutions in order to develop pre-employment pathways aimed at particular groups who experience disadvantage, who they want to be better represented within their workforce. Another major anchor strategy is around infrastructure investment, for capital investment, often really significant projects. It could be a new university campus, redevelopment of a wing of a hospital, a new arts and cultural centre. These are often, hundreds of millions of pounds worth of investment going into projects in the local economy that can have a really big impact on the number of local jobs created, the contracts which are awarded to build those buildings and those estates, and then the ongoing running of those institutions, and thinking about, again, what are the core functions and operations that are going to keep this institution running, and how do we design that so that it will benefit the local community and that investment will stay locked into the local economy rather than seeping back out again. And often infrastructure investment projects will also bring in procurement teams and HR and workforce teams, as well as estates and other finance, a huge range of colleagues. Then there is thinking about the environmental impact of what it means to be a really large organization based in a local area. So anchor organizations have a particular ability to shift the environmental conditions of the area they're based in by thinking about how they run their own organizations. And that's everything from the energy efficiency of their buildings to the way they incentivize their staff to perhaps walk or cycle to work. Partnerships and collaborations are also another key anchor strategy. There are some really wonderful examples of anchor organizations working with others. So perhaps a hospital system working with a large arts organization and a local authority to collaborate and draw in external investment into a region or county or borough. So thinking about developing a shared vision for a region or a town and then articulating that as a collective. So being the kind of ambassadors for a city or a region, and working in partnership both on that and of course could be on a whole range of things, as we heard about with the wider anchor collaborative and network point. And then finally, last but definitely not least, is kind of thinking about what anchor organizations can offer the local community. So what can anchor organizations do that will leverage their very specific skills and resources and assets to benefit the local community? Is that offering their physical resources, their spaces? If it's a university, is that about offering some of their research capability? If it's a hospital trust, is it about running mental health first aid in the community? There's a whole range of ways in which the skills and kind of assets of an anchor organization can be better deployed to really benefit the local community and engage with them in a different way, not just on particular kind of pieces of design or projects or commissioning. So those are the main strategies that anchor organizations will use in a nutshell. Lastly, I wanted to touch on why do this? Like, what are the big ideas driving this? And there's a few things to touch on here. The first is the concept of sticky capital. So the reason we're talking very specifically here about anchor organizations as public sector institutions is because they are unlikely to leave the area. So many private sector organizations might not be as tied in the long term to a particular geography, and anchor organizations usually are, either because of their estates or because of the way they deliver services. And as such, they are sticky. So they are likely to stay in the area and they can make different, slightly longer term investment decisions that are also aligned to their goal, their mission, which is more often than not about the health, well-being and prosperity of the local community. So there perhaps is a stronger alignment between their corporate functions and what they're spending and their workforce and their end goals around how that will benefit the local community and what kind of community they are based in. Then there is this kind of core concept, a core idea behind this is realizing the economic potential of anchor organizations. So we're talking about often the largest spenders and employers in a town, city or region. In some parts of the UK, the collective anchor organizations might represent over 30% or more of the local employed workforce of the local population and spend well into the several hundreds of millions. So we're talking about a really significant economic actor that can have a much more intentional and focused impact if it's thinking about how all of its resources are better aligned. So it's really about realizing the latent economic potential that anchor organizations have. And lastly, one of the big ideas driving this is that of community wealth building and ways of thinking about using that economic power to democratize the economy. So thinking about who owns what, where money goes, how resources circulate, whether they're kept locally or whether they go internationally or nationally. And that's the kind of one of the key economic ideas driving the anchor institutions concept. We'll leave it there for the introduction and hope you enjoy the other resources available.